Have you ever received a medical test result with something unexpected, leaving you wondering what it all means and what to do next? It is a common experience to feel a bit overwhelmed by medical jargon, especially when a report highlights something outside the normal range. Understanding these reports is a key part of taking charge of your health journey, and knowing what an elevated marker might signify can truly make a difference. An elevated marker report reveals that certain substances in your body, measured in a blood test or other sample, are present in higher amounts than typically expected. This finding is a signal that your doctor will want to investigate further, as it can indicate a variety of underlying conditions, including inflammation, infection, or potentially the presence of a disease like cancer. However, it is very important to understand that an elevated marker alone is not a diagnosis. Instead, it is a piece of the puzzle that helps guide your healthcare team towards understanding what is happening inside your body. These markers, often called biomarkers, are specific molecules or substances that can indicate normal or abnormal processes in the body. For example, some common markers include blood counts, enzyme levels, and what are known as tumor markers. An elevation in a specific marker can be caused by many factors. It could be due to a temporary inflammation, a benign condition that is not serious, side effects from certain medications, or even lifestyle factors like diet and exercise. In some cases, an elevated tumor marker, such as CA125 or CEA, can suggest the presence of a tumor or disease progression, but these markers are rarely conclusive on their own due to their lack of specificity, meaning they can also rise for non-cancerous reasons. So, what should you do if your report shows an elevated marker? The most crucial step is to calmly discuss the results with your doctor or healthcare provider. They will interpret the findings within the context of your overall health, medical history, and any symptoms you might be experiencing. Your doctor will likely recommend further diagnostic tests, which could include repeat blood tests, imaging scans such as an ultrasound or MRI, or even a biopsy, to pinpoint the exact cause of the elevation. Avoiding self-diagnosis and relying on professional medical guidance is essential at this stage. It is also helpful to remember that a single elevated reading may not tell the whole story. Healthcare professionals often look for trends over time. A slightly elevated marker that returns to normal on a retest might be less concerning than a marker that shows a consistent or increasing elevation across multiple tests. This dynamic view helps doctors differentiate between transient changes and more persistent issues. Understanding this concept can help you focus on the bigger picture and avoid unnecessary worry over a single, isolated result. Ultimately, an elevated marker report serves as an important call to action, prompting a deeper dive into your health. It empowers you and your medical team to explore potential issues early, leading to timely follow-up and appropriate management. By working closely with your doctor and undergoing any recommended follow-up tests, you are taking proactive steps to understand your body better and safeguard your well-being, transforming a potentially unsettling report into a pathway towards clarity and informed health decisions.